Hello, this is Harry Hobson, President and CEO of Plymouth Harbor.
And I'm Karen Novak, the Administrator for Strategic Healthcare Initiatives here at Plymouth Harbor as well.
Karen, today we agreed to give another update here. There's a lot's been happening in the last, actually 24 hours, a little over 24 hours now. So we're going to try to clarify some things for all of us. So this update will consist of a normal campus update regarding COVID-19. And then we'll give an explanation of the updated CDC guidelines and how it does or does not impact Plymouth Harbor at this time. And then I'll go through and just give a restatement also of the parameters for gathering sizes that we reviewed over the last couple of weeks, just to reinforce that. So Karen, why don't we begin with the campus update on COVID?
Again, we get to start off with such great news by saying we have no residents that are positive. We do have 5 residents that are under observation, and these are residents that are post-hospitalization, and they're all doing quite well. They're all asymptomatic. We have 1 team member that is positive and coming towards the end of her isolation period, and we look forward to having her back in memory care where she belongs.
Good. Thank you. Thank you. A good report. We like to hear those short reports. So
Absolutely.
okay, let's spend some time now on the updated CDC guidelines for visitations. Once again, we're issuing a splash dated March 9th, 2021, which will pretty much mirror this update we're giving on video. So we'll move right into the guidelines for visitations. And as most everyone knows, the CDC issued their first set of guidelines on how fully vaccinated people can visit safely with others. It's important also to know that continuing care retirement communities, such as Plymouth Harbor, are considered within the definition of the healthcare network. Now, having said that, and that's as defined by the Florida state statutes. So we need to wait until the CMS, the Centers for Medicare and Medicaid Services, collaborate with the CDC and the Department of Health when they put out their guidelines that it truly will impact Plymouth Harbor. We hope that we're going to see this soon. I mean, we could see this as soon as late today, tomorrow, or a week from now. But we have to wait for those guidelines to be released. So in the meantime, Karen, the CDC has issued the following visitation guidelines. It says, visit with other fully vaccinated people indoors without wearing masks or staying 6 feet apart. And the second one, I'm going to ask you to comment on it, visit with unvaccinated people from one other household indoors without wearing masks or staying 6 feet apart if everyone in the other household is at low risk for severe disease. Could you talk a little bit about that? I know there's many questions.
You got it. First I want to kind of define what fully vaccinated means, because we actually utilize that with our visitation program now. Fully vaccinated, according to the CDC, is having both of your shots, the COVID-19 vaccines, as well as 2 weeks out from that last booster. That is somebody that is fully vaccinated. They have their full immunity at that particular time. The statement that Harry is referring to about going into a household and staying that 6 foot away, it mentions one household. And let me give you an example about that. Let's say you go to your daughter's house and your grandchildren are there. And oh, by the way, it is so nice to know outside of Plymouth Harbor and you go to your daughter or son's house and your grandchildren are there, you can take off your mask and you can give them a hug. That's acceptable from the CDC. But if your daughter's neighbor all of a sudden pops in to say hi, that means there's 2 households there in that one area. So you must don your mask because now you have 2 households in one room. Again, the CDC says one household and not two households allows you to have no mask and not have to distance 6 feet apart.
So Karen, when we were all hearing all over the news, okay, with the press conference yesterday afternoon, I think certainly through the evening and early this morning again on much of the cable networks, talking about people going without their mask. Number one, that's not necessarily a wise decision at all, but that freedom certainly does not exist here at Plymouth Harbor.
No, again, we fall under that definition of a healthcare facility. Now, we utilize that to our advantage when it was time for vaccines. That's what allowed us to provide you with the vaccines by being under that umbrella of a healthcare facility. So, right now, like Harry mentioned, we must wait for CMS to come out with the guidelines in a collaborative effort with the CDC.
So we're going to ask everyone, please go easy on what you've been hearing over the last 24 and now 48 hours until we get specific guidelines, and we'll release those to you as soon as we receive those. And that'll be that collaboration with the CDC, Department of Health, and really the Agency for Healthcare Administration. Okay, once again, because of our categorization here in Florida with the Florida statutes. So when you look at our visitation guidelines, okay, it says independent living resident visitors, and this became effective yesterday, which was March 8th. We reopened visitations for our independent living residents for visitors who have been fully vaccinated. Okay, so those are folks that have received their booster plus 2 weeks. Again, according to the CDC and others' definition, that's fully vaccinated. Our screeners, of course, will be asking for proof of vaccine and also a photo ID. And then our independent living visitations will be limited to the residence apartment. So you may have visitors in your respective apartments. And we've not yet decided exactly when or where we're going to open up for more of a communal visitation. So Karen, I know we have gotten a question or two already regarding overnight guests. So why don't we go ahead and respond to that?
Sure. We are opening quite a number of things right now. We've got the opening for guests, external guests to come into our environment. We're opening up the dining room next week. We're opening up wellness. We opened up the Smith Care Center dining room. So what we're going to do is kind of take it in for just a couple of weeks, maybe 3, and then see how we're doing. Look at our numbers, make sure that we're not escalating any kind of positivity here at Plymouth Harbor. We've done pretty well. And we want to keep that pace of having no residents positive. So give us a few weeks before we can open up for overnight stays in your apartment. Currently, we do not have any guest rooms available, and that's due to the Windows project. As you know, Harry, some of our residents are taken out of their apartments while they're having new windows put in,
Right.
and they need a place to go. So that's where the guest apartments are actually being utilized for those residents that are getting new windows. But all in good time. We'll get there, but we're going to get there slowly, and we're going to get there together.
And very thoughtful. And that's what we've tried to do for, next week will be 1 year, or later this week will be 1 year officially since it was declared a pandemic. So we don't want to jump too fast now because we're almost there. I've also been asked a question as far as visitations in the regulated areas, okay, more regulated, and what they're referring to as assisted living, memory care, and our nursing home, the Smith Care Center. How does that visitation work?
Things have not changed over in the Smith Care Center, the assisted living or memory care. ACA, which is our Agency for Healthcare Administration, has given us definitive guidelines that we have to comply with. We have what we call an essential visitor. This is somebody that actually provides care, direct hands-on care, or emotional support for a loved one that is in one of those entities. That has not changed. We've not opened that area up quite yet for open visitation like we're doing with our independents. But this is what that CMS CDC collaboration will help us understand what we can or what we cannot do. So currently status quo with our regulated areas, and we're very excited to see what CMS is going to allow us to do.
Karen, our conversations earlier today, you kept emphasizing with me, please make sure we steer our visitors to the right entrance. So all visitors for independent living should come to the tower main entrance for their screening. Is that right?
That is correct. What you're going to have to do with your visitors that are coming to see you is they need to bring that vaccine card that the CDC supplies for them. It gives us the idea that they indeed have had their vaccines. And then we need a driver's license. It doesn't have to be Florida, just has to have a picture ID attached to it.
Okay. And then I'd like to close out a little bit with basically restating our parameters for gathering sizes. Okay. So what we've said was small group inside gatherings should not exceed 10 attendees. Please remember to utilize precautions, again, social distancing, hand hygiene, etc. Now, most of the small inside group gatherings would take place around campus, including colony rooms, the mezzanine area, and the chapel. Mm-hmm. Then we continue to support, okay, that's now the step up, moderate sized gatherings, not to exceed 20 participants. You would find that for meetings in the cafe, bistro, or Pilgrim Hall. Once again, fully vaccinated people should continue to follow all the guidelines for this setting, which includes, again, well-fitted masks, maintaining physical distancing, and washing your hands frequently. So that's very important. We wanted to restate that. We've actually gotten some good responses. I know we've gotten some nice gatherings now in those areas since we introduced this very recently. And then testing. You wanted me to remind everyone if they wanted a test.
Yes, if you would like a COVID test, you are more than welcome to come down to home care and we'll be glad to do that. But interestingly, we have actually had a number of residents come to home care or give me a call and say, you know what, I'd like to have an antibody test. Mm-hmm. I want to see if I've got those antibodies built up. And we can make that happen. What we need for you to do, though, is to contact your doctor, have them fax us, the office, the order for it, and we'll actually get a hold of the lab and have that lab technician actually go up to your own apartment and draw your blood. And then you too can identify if you've got those antibodies built up.
Okay, thank you very much for that as well. And also just as a kind of a reminder to everyone, next Monday, that's March 15th, that'll be our final vaccine clinic. And we're excited about that. It has been just a total success. And we started back on December 30th. And we will conclude all of our vaccines next Monday, March 15th. And by that time, we will have done over 2,500 vaccines. So boy, my hat goes off. All of our team members who participated in the clinic, our volunteer residents, and Karen, our friends from CVS.
Yes, amazing teams, just amazing teams on both ends.
Absolutely, absolutely. Well, Karen, as we bring conclusion to this video, I just want to continue to thank all of our residents, their families, and team members for your ongoing support. We've been at it as a pandemic for in a couple of days, it'll be a year, and we're almost across the finish line. I can feel the optimism for sure. I know ever since I've gotten 2 weeks past my booster vaccine, it just feels like the weight of the world has been lifted. And I know many, many people feel that way. So Karen, as always, why don't you give us a reminder?
I'm going to add one to it this time, though. When you are out in public, going out to either a restaurant, out to eat, shopping, please remember to wear that mask out there. Just because you've been vaccinated, when you're out in the public area or the arena out there, please protect yourself. Know that you can still transmit that virus to somebody else who may or may not have had the vaccine. So wear your mask when you're out there in public. We want to remind you to wash your hands quite frequently during the day. Hit those high contact areas with some antibacterial wipes. But again, I reiterate, please, when it's so easy to do, remember to don your mask anytime you leave your apartment.
One thing I almost forgot, and you would have reminded me of this later, and that is, do you want to comment on travel?
Oh, absolutely. If you're thinking about traveling, CDC does not recommend you leave the continental United States. But if you must, please remember to call your airline to check on the COVID testing. Some of the areas require you to have a COVID test done 72 hours before you leave the United States to go wherever you're going, and then 72 hours before you return. And then when you come back, you have to self quarantine for 10 days. And again, that's because of all the variants that are kind of happening, especially in Europe. We're seeing a resurgence of COVID over there right now. The UK variant, I know in Milan, they actually had a 33% increase in 1 week in their school system. So they shut down the whole school system itself. So know that it's out there. Please be cautious if you have to travel. Please follow those same guidelines that we use here at Plymouth Harbor when you're out there in the world.
Okay, thank you, Karen, very much. That brings conclusion to this edition. So I think it's time to don our masks.